We've learned over the years that the best way to manage ADHD is with a combination of different approaches. What that combination looks like will vary depending on the individual child, but it'll often include behavioural therapy, educational interventions, and medication. Every child with ADHD is different, so no two treatment plans will look alike. A child with predominantly hyperactive ADHD, for example, will have very different needs to one whose main problems are with concentration and attention. That's why it's so important that your specialist conducts a thorough assessment before making any treatment decisions. The assessment will tell them what symptoms are causing the most serious problems in your child's life and should be targeted. It'll also provide a baseline against which progress can be measured. ADHD is treated with a comprehensive program that typically includes psychological, educational, and social measures. Behavioural therapy can give children and their parents the skills they need to change negative behaviour and to learn more positive behaviours. Strategies to help the child perform better at school are another important part of any treatment plan and can include everything from coaching on study habits to asking teachers to break up tasks into more easily manageable chunks. Most children and adolescents with ADHD suffer from other disorders at the same time, which can also affect their behaviour. Depression and anxiety are common, and talking to a therapist can be helpful in addressing some of these problems. Medication can be prescribed to children aged over 6 years old and adolescents, and must be done by a specialist in the treatment of ADHD. Medicines won't cure ADHD, but they can control the symptoms. They can increase concentration and attention span and reduce hyperactivity and impulsivity, giving your child a space in which to learn and practice new skills. The decision to start medication is not an easy one for most parents. Many are worried about side effects or how it'll affect the child's development. However, the evidence we have shows that ADHD medicines are generally well tolerated by most patients. If parents do find they have any concerns over side effects, they should always speak to their doctor, who will be best placed to give them advice. Medication won't be suitable for every child, though, and even where it is appropriate, it's not always needed for a long period of time. One thing I think people sometimes forget is that the treatment plan should evolve over time. Very often, children are diagnosed and start treatment when they're still quite young. As they grow and change, their ADHD changes too, with hyperactive symptoms often moderating and attention problems becoming more prominent. Children also face new pressures and challenges as they develop, particularly as they enter adolescence, which can bring new problems to the surface or aggravate existing problems. So it's important that as a child develops, their progress is monitored closely and that the treatment plan is reviewed regularly. With my own patients, I try to do a comprehensive review at least once a year, but I'm always happy to bring things forward if the parents have concerns that treatment is not working or is no longer a good fit for their child. So how do you know when it's time for a change in treatment? We make sure that we check whether we think the treatment is working and needs to be changed at least once a year. I also encourage parents to keep a diary. It's a great way to track changes in behaviour and see what progress your child is making against their treatment targets. You can record any improvements in core symptoms, keep a record of their performance at school, and note down any new issues like sleep problems or increased forgetfulness. If you don't see any improvements over time, or new problems suddenly emerge, then you should arrange an appointment with your specialist. It's a good idea to write down your concerns beforehand and bring this to your meeting so that you can be clear on the issues you want to discuss. It's also worth thinking in advance about questions you'd like answered. You might want to know, for example, what other medicines or treatments are available and how effective these alternatives are. Remember, sometimes it may be appropriate for a child to change medication as they grow older. A child's needs can change as they get older, which means that they may need a different type of medication to manage these changing needs. Also, it's important to remember that a child may reach a point where they no longer need medication and can cope with behavioural therapy alone.